Greetings, I'm Dr. Steve Tashiro. I want to welcome you to this brief introduction to irritable bowel syndrome, Crohn's disease, and digestive disorders. I'm a nutritionist and board-certified chiropractor with over 37 years of experience in the healthcare field. During that time, I've had the privilege of helping thousands of people overcome chronic health conditions. For many of these people, the key to regaining their health was restoring proper GI function. And that's not surprising, since 70 to 80% of the immune system is in the intestines. And our ability to nourish and strengthen our bodies depends on the breakdown and assimilation of the food we eat and converting it into energy that fuels our body. Hippocrates, the father of medicine, said, "Look to the gut. There you will find the cause of almost all human illness." I see this fact demonstrated time and again in my work with people with chronic health conditions. Whether I'm helping a person with a thyroid problem, sugar regulation problem, chronic pain, fibromyalgia, adrenal challenges, chronic fatigue, or autoimmune problems, and outright digestive problems, there are almost always GI issues that need to be resolved before healing can occur. One reason a healthy GI system is so important is its connection to the brain. The phrase we use to describe this relationship is fire in the gut equals fire in the brain. And this is what that means. If you have inflammation in your gut, you likely will also have inflammation in your brain. The gut inflammation can be the result of a lack of necessary digestive juices, poor intestinal bacteria, infectious organisms like parasites, yeast, mold, and fungi, or simply eating foods that your body does not tolerate. All these factors can cause an increase in cytokines, immune cells that attack foreign invaders, but in the process damage the gut lining. This is called a leaky gut. These same inflammatory cells can then travel to the brain in the blood, travel across the blood-brain barrier, and cause inflammation in the brain. The effect of this can cause brain fog, short-term memory loss, mood disorders, and a host of other neurological problems. Let's talk specifically about irritable bowel syndrome. The symptoms of IBS include abdominal pain, gas, fullness, bloating, acid reflux, usually relieved by a bowel movement. With IBS, you can also have constipation or diarrhea or both. 60% of IBS sufferers also experience psychosocial disorders like anxiety or depression. And that's not surprising because the symptoms of IBS can severely disrupt a person's normal daily activities. Additional symptoms could include headache, fibromyalgia, and chronic fatigue. IBS is in fact the most common cause of a visit to a gastroenterologist. And in our country, the US, 1 in 6 people have IBS. IBS is considered a diagnosis of exclusion, meaning if you have these symptoms, but tests show that it is not caused by Crohn's disease or ulcerative colitis, then it is assumed that you have IBS. Crohn's disease causes similar problems, but the cause can be quite different. Crohn's is an inflammatory bowel disorder. Ulcerative colitis is the other most common inflammatory bowel disorder. Both of these involve inflammation in the GI tract. With colitis, the inflammation is localized in the colon, while with Crohn's, it can occur anywhere between the mouth and the anus. Both Crohn's and colitis are autoimmune diseases in which your immune system is damaging the lining of the intestine, possibly as an overreaction to proteins on the surface of gut bacteria. The medical approach to IBS and inflammatory bowel disease is to treat the symptoms with medications. For example, with IBS, anticholinergic drugs like dicyclomine are used to inhibit the intestinal contractions, while with the autoimmune bowel disorders, immune-suppressing drugs like prednisone are the treatment of choice. On the other hand, in alternative health care, our approach is to identify the root causes of the dysfunction and restore normal physiology with non-toxic, non-invasive means. With IBS, we would need to determine if there are optimal levels of digestive enzymes, hydrochloric acid, and friendly bacteria. Also, if there are bad bugs living in your gut. We also need to know if you're eating foods that are causing inflammation, or if GI function is being disrupted due to poor regulation of other systems that can affect digestion, like your thyroid, adrenals, and sugar regulation. And the way we determine this is through the appropriate lab tests. We also have to determine if the GI regulating center in the brainstem is doing its job. We determine this with specific neurological tests and correct any interference in normal function with what we refer to as brain-based therapy. In other words, brain rehab targeting the areas of weakness in the brain. The key in helping people with the autoimmune inflammatory bowel diseases is to determine what is causing the immune system to attack healthy tissue, and we call these immune triggers. Immune triggers can include dysregulation or poor regulation of any of the major organ systems in the body, or the presence of an antigen. And an antigen is just a fancy word for a germ, which could include virus, bacteria, parasite, yeast, chemicals, toxic metals, or even foods that you're eating that your body is reacting to. To summarize, I want to assure you that you don't have to just learn to live with your GI disorder. We have helped many people suffering from chronic GI problems. Remember, the lining of your GI tract is replaced every 7 days. So once the stressors are removed and we provide what's missing in the way of appropriate enzymes and bacteria, the healing of the GI system can occur surprisingly quickly. We've made this DVD as an introduction to our office and to the topic of IBS and Crohn's and other GI disorders. Also as an invitation for you to attend our next talk on IBS. So I encourage you to call our office and reserve a spot at our next talk. You can call Jennifer at 303-985-5540. Or if you've heard enough and you know that you want our help, call Jennifer and schedule a 2-visit case review and consultation so we can determine if you're a good candidate to be helped by our programs. The normal fee for these 2 visits is $198, but because you've watched this DVD, we discount that fee to $77. And once we've had those 2 visits, if we determine that we're not able to help you, we gladly refund your $77. So thanks again for observing this DVD. I've enjoyed sharing this information with you. I look forward to seeing you at one of our talks or in our office for our 2-visit case review and consultation.